everybody, this is Mel K with tentalk.org, TENNTALK.org, and today I have a guest, and his name is Dr. Scott LePor, and Scott is definitely on the missions that we're on, and today we're going to discuss what's inside his brain and what his philosophy is, and just any kind of projects that he has going on. So Scott, can you tell us a little bit about your background?
Yes, and so thank you for having me too. It's such a privilege. My background is I'm an osteopathic physician. I do family practice and really was just in mainstream medicine. And being an osteopathic physician, I did have more of a preventive mindset, but it really was mainstream medicine. So really what impacted me to change in my practice and actually different aspects of my life is we started to foster. My wife and I started to foster about 4 years ago. And our first foster child came from a very difficult background. She had a lot of traumas. And so we were well-meaning people. We wanted to help her. And everything we tried really kind of made things worse. And we didn't know what to do. And in our training, we went through a faith-based foster organization in the state of Georgia. And they did expose us to the connected child, and this is a study, it's a book that was put out based on evidence of healing the brains of children from trauma. So it was really geared towards foster and adoptive parents. And so we were exposed to it, and as a physician for psychology, at that time, I really didn't see much benefit for it. So I thought it was nice. I thought there was maybe some useful tips when we had that exposure. But it wasn't until we were really struggling to help this child that we started to go back. And we went back and read The Connected Child. We started to implement the principles for this. And it was absolutely amazing. So we bred connection with this child. Within 6 months, she was literally a brand new child.
6 months?
Yes.
Wow.
So the data shows that implementing these principles takes about 1 month per year of age to help heal the brain. So DFACS, CASA worker, our consultant, case manager were just so impressed, and they said, what the heck are you guys doing? We've never seen a child with this much trauma heal so quickly. And then we just shared the principles we were doing. So amongst this, I applied for a scholarship out to TCU. This comes from Texas Christian University Institute of Child Development, and which has recently been renamed the Karen Purvis Institute of Child Development, as she's passed away in the last couple of years. And I went out there for training to be a practitioner and then an educator, and it's called Trusted Based Relational Intervention. So these principles really are trauma-informed evidence that show how to heal the brain in people, and it's impacted the way I practice medicine. Now being in trauma-informed practice, but understanding my patients, where they come from. And part of my training was actually I had to do the adult attachment interview.
Okay. Which,
if anybody's familiar with the attachment theory, John Bowlby, Mary Ainsworth, Mary Main, and now so some modern like Dan Siegel, very heavy into attachment theory. I had to do the adult attachment interview, and that really got me understanding my own past and where my own attachment flaws were. So this really set me on a journey to revisit who I was. And actually at the time was chaotic for me, because I also, for the first time, came to the conclusion I really didn't know who I was. And then a lot of things in my life made sense, and my parents used, so very loving people. My father's a physician, pediatrician, my mother was stay-at-home, and they used all the tools they had to raise me the best they could. And as I revisited their own childhoods, man, and I started to realize, wow, they had difficulties in their childhoods, and so who I was made sense. And then understanding that most people that get involved in foster adoptive care and caregiving, over 80% have insecure attachments. So most of us
80,
have.
yeah.
So it was pretty amazing to find out that I was kind of seeking my own healing in helping others as well. So what science shows over and over is that if I want to help someone else heal from their trauma, I've
Mm-hmm.
got to go back to my own. And what I can't do is get a book or a set of principles and then try to apply them to somebody else without me making sense of my own past. So it really became an integral part of helping others heal. So once I saw my own attachment flaws and understood what secure attachment was, and that the four basic principles that they can give care, receive care, I'm okay with autonomous self, and I can negotiate. And as I saw some of the flaws areas in my own life and started to work on them, I was able to help other people. So we started to connect with this child. It was absolutely amazing, and it was profoundly rewarding, because now I wasn't just someone that wanted to help the
Mm-hmm.
child, but I had the tools to do it, and I saw the benefit that she had. So we started to implement this. Actually, so we have a biological child, and we started to use this as our own caregiving model. I started to educate others and give classes on this model. TBRI, Trust Based Relational Intervention, is just that. The science is showing that behavior, for the most part, is dysregulation within the brain, and there's typically a cause. So behavior is never the problem. And if we think about it with ourselves, so if I go to work and my relationship's not doing very good at home, and I've
Mm-hmm.
got financial problems, and I'm not feeling well, and I'm sleep deprived, I'm going into work probably not very happy
That's
and
right.
not connecting. But if I have a boss who says to me, "Hey Scott, you don't have a smile on your face today. Why don't you go home until you can put a smile on your face? And maybe you should just be thankful you have a job. What's your problem?" So he tries to work on my behavior. Well, what that does to me, that's a punitive approach,
Mm-hmm.
and that breeds disconnection. Now I really don't like my boss. I don't like my job. I want to get out
Mm-hmm.
of here as soon as I can. But if I have a boss that comes to me and says, "Scott, you don't seem to be really happy today. Are you okay?" Because I know that's not who you are. Is there anything I can do? And then I start to share my problems. And he says to me, "You know what? We got you covered. Why don't you just take the rest of the day off and take care of that issue, and then come back and we'll help you. We'll work on this together." Then that breeds connection. And I start to love my job. I love my boss, and I'll never leave that place. So I'll do whatever I can to stay. Whereas the other model, I'll do whatever I can. The first chance I get, I'm out of here.
That's right.
So what the science is showing is that the more connection we have with people, the more that people are willing to help me in a healthy way, the more I connect. And then that in of itself usually resolves behavior problems. However, if I have behavioral problems because I just don't have the tools to behave in the way that I should in a
Mm-hmm.
society that's healthy, then I probably need help with that as well. So what we started doing for these children is looking for all the positives we could of what they did right, praise them for it, releasing dopamine in their brain, building connection, meeting their needs, and making sure that we had an understanding of where they were. So when they came into our home, they most probably did not feel safe. So we needed to do whatever it took to make them feel safe. And then and only then could we build a relationship. And something was said in a book that I read that was very impactful about fostering. And when I first came into fostering and we had our child, we made it like a party, and we felt like this child should be so happy because we just rescued you from a traumatic lifestyle that you were having, and this
Mm-hmm.
child will just be so grateful and thankful to us. And someone said in a book, and it was about fostering and adoption, but they said if your biological child, let's say at the age of 3, was abducted and for 4 years went through brutality, neglected, abused, um, traumatized, and the police find that child, and after 4 years they bring that child back to your home, what would you do? Would you take the child to Disney World? Would you throw them a party? Would you buy them a new pony?
Mm-hmm.
Well, you wouldn't. You would probably take off of work, and you would help the child heal, and you would mourn with the child, understanding their trauma, and you would be very gentle about regaining that connection. But you would take the time to do it. So it really was impactful for me, because to understand that that's where a lot of children from trauma, that's where they are in life. So we became patient, and we started to meet their needs, and we let them in their timing build that connection as we just developed security for them. So it became very powerful in that we saw connection immediately, we saw change, and then we saw joy come into their lives. So the principles are this is empower is the first one. I'm going to meet your needs, and then to connect through relationships. So we do things together and we get to know each other. And then the third one is the correcting principles. And half of the correcting principles are proactive, so that even during connection, I'm always doing, and in a playful way, even with dolls, depending on the age or whatnot, but we're always doing what's proper behavior of how we treat people. There's no hurts, there's no hitting, we ask. But we do it in a playful setting when we keep that child in the prefrontal cortex. And we can talk a little bit about the brain and how that works.
Yeah.
But that's really where I learn, I remember. And they also have poor wiring from their previous traumas. So not only is it wiring that prefrontal cortex in a way that they can function with success, but it's also rewiring from previous traumas. The behavior will come out in a wrong way because of a trigger that they've had in the past.
Mm-hmm.
So it's really helping that child rewire their brain for success in the future.
Yeah, and I think that is so important that you bring up about the brain, because no matter how old, any type of adversity for trauma, whether that's moving or a death of a loved one or even witnessing an abusive relationship, creates trauma in that brain development. And what I like about Scott's philosophy and practices that he is doing, not only is he a physician and has a really strong desire and mission for foster and youth, is that he's relating this very complex, I guess you can say, situation into a way that can be communicated for everybody to actually learn the steps from. And so it's about that transition from when you actually do have a child going into foster care or even coming out of adversity. But from what I'm hearing from you, it doesn't matter how long that has been to where maybe they have been introduced into a new family. It's something that can really be started at any time and still have the same results.
Yes. So depending on the trauma, so that it will take longer. So also it will take longer to establish that initial trust based on the trauma they've had, and then the age that they are. So Karen Purvis, who was previously the director, now Dr. David Cross, she believed any child with any trauma with this model could be healed. And she never had a failure in her model. However, it takes patience, gentleness, kindness. It is actually a model that's built on high structure, high nurture. And if you know parenting styles in psychology, we have neglect, which is no parenting style, and then there's permissive. So I'm high nurture, but there's really no structure. And then there's authoritarian, where it's all structure, no nurture. Authoritarian is where the parent is in complete control. It's my way or the highway. Permissive can be where the child's in complete control and they run the family. And the perfect model for the brain is that authoritative. So I'm always in control, but I share my power with you. I give you a voice. I give you choices. But I'm always here to guide you to what's appropriate, what's not appropriate. So that is where the brain thrives. And we also understand that in also what I do is a medical director currently of patient experience and physician engagement. And so we're using these exact same principles for our physicians and for patient experience. So with our physicians, if I'm here to meet your needs, connect with you, make sure that you're happy, your life is in balance, we know that that carries on to the patients. So happy physician will give happy patients.
And what results have you seen by implementing those models?
So I don't have the specific numbers, but it's pretty amazing. So the first year we started to implement this, we had a new director, Brendan Nieto, Associate Vice President of the clinics. And when he started to implement these, we went from, I believe it was the teens or the 20s of satisfaction up into the 80s.
Wow.
So, and this is where we can see with children, if we say 1 month per year of age, you're talking about really kind of completing the healing. But it starts immediately. So just like if we go back to the model to where I'm having a bad day at work, but someone comes to me compassionately, right, there's connection immediately. So actually, just by the way we hold our eyes towards somebody, they will understand compassion. They know that I'm safe to connect with you. But if someone comes at me with punishment or sternness, we immediately disconnect from that person,
Of
or until
course.
we see. So the whole model is based on that nurturing approach.
Yeah, and I think everything that you're saying is definitely in line with what we believe at Tennessee Advocacy Talk, because we have an initiatives, and it's done from a study from over, like 10 years ago. And basically it's adverse childhood experiences. And we do have the information about how the brain is developed with trauma intact, and even toxic trauma, meaning lasting for a long time, which is like neglect,
Yes.
and that executive functioning and just the emotional type development of the brain doesn't get completely developed in certain key ages of the most development possible. And so we here in Tennessee definitely discuss that with the treatment side of it and the social working side, but I'm extremely interested because you're coming in from the physician side of it. So can you talk a little bit more about that?
Yeah, so understanding the current neuroscience of this, and by the way, so a lot of this neuroscience, and actually when you talk about trauma informed, almost all of this is not mainstream medicine today. So what we're getting on the front line of research, you really have to go investigate or read. I actually did have in a recent medical journal a trauma-informed article on sexual abuse and what happens in the brain, and it was wonderful to see, and it was all accurate. So what we do know, there's awareness now with adverse childhood experiences and how it affects the brain. The missing part was how to fix the brain to that, and that's what that trust-based relational intervention is. So even things like sensory processing disorders, to me as a physician, I really would look at it and go, man, this kid just needs more structure. So it was just a behavior issue to me. But understanding that trauma can start in utero. So when that child or the mom is pregnant with the baby and
Mm-hmm.
she's going through bad relationships, drug abuse, alcohol, stress, I don't know where I'm going to live or where I get the next meal from, that cortisol actually washes over the brain of that child in utero. So that affects brain development.
Mm-hmm.
The first year of life, the most important factor for neural development is nurture. So studies done on orphanages from Russia and Romania showing that neural development is nutrition important? Absolutely, the child will die without it. But for neural development, the most important factor is nurture.
Mm-hmm.
So that's the whole attachment cycle. So at birth and in utero, your five internal senses are developing, and at birth they're almost completely developed, right? And so Dr. Brazelton in the 80s, he's the one that brought understanding to that. We were doing procedures on children without anesthesia because we didn't think they had senses, and he proved that they did. So now we can understand that even at birth, if someone adopts a child and we think that we've got them before anything happens to them, we find out that's not the case because they will end up also with a lot of times developmental delays or
Mm-hmm.
behavioral issues, but yet we thought we got them before trauma, but yet we see the trauma affects it in utero.
Right.
So at birth, the brainstem is almost completely developed, and that's why your child can, when they're hungry, they get angry, they cry, they will tell you they have a need, but it's all brainstem reaction, which is that fight, flight, or freeze. So the prefrontal cortex, so you're talking about 100 million neurons are there, but they're not wired yet.
Mm-hmm.
So that amygdala, the midbrain, is what determines when I become either prefrontal cortex or brainstem. So what happens to a child in the first year of life, that adult attachment cycle, is that the baby has a need, expresses that need, and that's your sympathetic response. Then a caring mother who knows what that cry means and comes and meets that need, then you get that parasympathetic response, and that completes that cycle, but you're actually wiring the brain of the child. So when I'm 2 years old and I get hungry or thirsty, I can say juice, juice. And at 4 years old, I can go pour that glass of juice. But it's from the very beginning that has wired that ability to happen. So now if I have a parent and they've been raised in maybe trauma, so they're mostly brainstem, they hear a crying child, and to them that provokes fight, flight, or freeze, right? I'm going to get angry when that child cries, or I'm going to check out with alcohol or maybe drugs, or I'm out of this relationship. So what I do is I leave a child who's in brainstem behavior, and
Mm-hmm.
what's happening? They're overdeveloping and enlarging that brainstem. So what does that child learn? When I have a need, I become angry, or I shut down, or I so this is where the brain of the parent becomes the brain of the child. So this is where we see these patterns develop and then pass on. So now if someone steps in with secure attachment or more secure attachment, and I meet your needs and I soothe your distresses and I amplify your joys, this is where we can rewire the brain of that child.
Right. That is so on key right there. And I think, it's important for us to understand what adverse childhood experiences can do with the brain, and it's getting more popular, I guess you can say, about talking about adversities, which it needs to be. Because adults can carry their adversities. There's a study done that 90% of people that need treatment don't get the treatment that they need, and it is through changing that environment that's actually going to help build that resiliency. And that's where we're at right now. We do have people that are now just getting their trauma, unfortunately, but we do have those that are in the middle of the trauma, and even those that are older that have still carried that trauma with them without any attention to it. And so part of Tennessee Advocacy Talk's mission is to help build that resiliency trail for them, to help them strengthen the environment in which they live, by basically taking their present situation and focusing on the future with what are we going to do now and clear action steps. And Dr. LePor is actually going to be helping along with that program development with Tennessee Advocacy Talk as well. And talking about the resiliency, what do you think one of the most important factors with resiliency is?
So bar none, secure attachment is the foundation for resiliency. There is interesting enough that there are some genetic variances, and some people have resiliency genes that give them a little more wobble. We also know that they lack malleability later on to change their brain patterns. So there is some genetic protection for some people rather than others. Some are more sensitive, but bar none, a secure attachment is the foundation for resiliency. So the more secure I am at my job, the more secure I am with my boss, the more secure I am with all my fellow employees around me. If something bad comes in a day, I have someone to go to. I know it becomes secure. But if I'm in a situation at work to where I don't have a good relationship with anybody, and my job is day to day, if some stressor comes in, I've got no resiliency. So secure foundation is everything. And what we see is that when children come from trauma, they are not very resilient, and we see bad behaviors, and these are really survival behaviors.
Mm-hmm.
And so instead of focusing on the bad behavior, but we come in and give them a strong support and guidance, that behavior most of the time will change on its own, which is absolutely amazing.
Oh yeah, and this just goes in line with our mission, just to change the environment for the youth, because it is not over for them. We do not need to wait for the next generation to change. It can be changed now, and through the coalition of our organization, our psychology type employees, and definitely now we are bringing on the physician aspect of it, because physicians do play a big role into this as well. And I do notice not a lot of physicians, and this is just from my own observations, have picked up on this, and we want to change that. We want to have a circle of all of the different factors for somebody to be successful, to have all those resources available, and a physician is a key resource.
Yes. And actually, so current studies showing, especially with the opioid epidemic, that there was a wonderful study, a Canadian study, pain management patients, over 200 patients in the study. But when a patient felt that their physician cared and listened to them, their pain was reduced by 55%. So what we're seeing in a pharmaceutically driven
Mm-hmm.
mindset, usually in today's mainstream medical care practice, is that relationships are the trumping factor. So we need to get back to focusing on connection with patients and have that trust base with our patients, and we can reduce the need for medication.
Yes, and that is such a valid point right there. And Dr. LePor, I just want to thank you so much for doing this interview and coming on board to help our programming to help build that resiliency, especially working with adversity in childhood experiences. Do you have any last words or anything you'd like to say to everybody?
No, and I'm just thankful for your organization and what you're doing. And my whole drive has just been to help those in need and give tools, just like what was given to me, changed my life because I was able to help others. And that's all I really want to do, is to share with others those tools for well-meaning people to be successful in helping others heal.
Okay, well, thank you. I
Yes.
appreciate it so much.
Thank you.
Thank you. And guys, you can find more about our missions and our programs at tentalk.org, TENNTALK.org. Have a great day. Thank you.
Thank you.